Good evening and welcome to Talking Point. As COVID-19 pushes us into new ways of adjusting our daily lives to ensure our health and safety, there are others who have less of a choice in how their daily lives unfold. This includes the growing number of prisoners around the world. According to the Ghana Prison Service, prisons in Ghana are about 52% overpopulated. At the Nsawam Medium Security Prison, prison cells are about 400% overpopulated, and this creates fertile grounds for the outbreak of any disease to thrive. Indeed, Ghana's prisons have been battling other diseases such as tuberculosis for a while now. Due to the congestion, recommended priority responses to COVID-19 such as hand hygiene and physical distancing are practically impossible to enforce in our prisons. Thankfully, last month, the President granted amnesty to about 808 inmates. Unfortunately, the prisons have now recorded some cases of COVID-19. Tonight, our main focus of discussion is the COVID-19 situation in Ghana's prison. We welcome those watching us on GBC News Ghana Television, on Facebook at Ghana Broadcasting Corporation, and streaming live at www.gbcghanaonline.com. And of course, those listening to us on Unique 95.7. You can also send us WhatsApp messages during the show to our WhatsApp number 055-744-6429. My name is Dr. Nimright, and in the studio with me tonight is Mr. Ibrahim Oponkwateng. He's the Executive Director of Crime Check Foundation and also the Prisons Ambassador. Good evening and welcome. Later on in the show, we are going to be joined via Zoom with DSP Dr. Lawrence Achampong. He's the Medical Superintendent of the Nsawam prisons. Now, before we begin speaking with our guests tonight, we'd like to highlight the issue of COVID-19 and stigmatization. Earlier this week, GBC focused attention on the stigmatization of COVID-19 patients. Seram Avotri, a patient currently under treatment at one of the treatment centers, spoke to GTV News anchor and host of Women's Voice, Selikem Akolache Apalu. Let's have a listen.
We were talking initially about the psyche of some of the people who have been affected by the disease, some of the problems that they have, the fact that they are going through some amount of trauma because they are in there, they are not working, and some of them have still not been able to come to terms with what this means for them. And you, being a clinical nurse, has been offering some education to them. Tell us, how are they doing, the persons you have been engaging with? How are they faring?
All right. Thank you so much for this opportunity, and shout out to all your viewers. I want to appreciate everybody for the support so far, especially my family, my wife, and all. Yeah. The situation here, as has been, hasn't changed any much to say, because I've just been here for about 5 days now, and it took me some time to start engaging some of the people in here. The reality is the few that I have been able to engage, I would say, are doing well. I've seen them doing better. They seem a lot more relaxed and ready to go through treatment. You know, the main issue here is the people feel that there's nothing wrong with them. They are not having any symptoms. They will tell you that it's said that when you have COVID-19, within 2 weeks, you should have symptoms that will actually kill you, or very severe symptoms that they've been here for 2-3 weeks and they are not experiencing any symptoms. So what is wrong with them? So that is it. So I need to take my time and explain to them how the virus works and then what is actually happening in their system to that effect. This is not to say that the health team here have not been doing their work. They have been doing that. They've been educating them. But you see, when you're educating a lot of people per time, and then the people have a particular mindset already, already their minds are blocked on you, listening to you. So they've not been listening to them. But when I take them one-on-one, I realize they started listening, and I've seen change, and then come in most of the people that I have had chats with. Yes.
Right. What about the issue of stigma? How are they dealing with it? And have you had any reports yourself of people in your family being stigmatized?
Well, this one is another issue to talk about. Right now, as I'm talking to you, just yesterday, my wife called me in the evening and she asked me, "Love, are you sure what you're doing? We're on the right path?" You know, what does that tell you?
Okay.
It tells you that she's hearing something, and then she has been exposed to something. Some people have given her calls to let her know, "Look, what are you doing? What is going on?" And as I'm talking to you, some of my family people have reported like they go to town, or they go to do something, and then they are receiving calls. "Hey, we had one of your family people because of the name advertised. The name advertised, that's why they hear the name. We had one of your family people has COVID-19, and then he's on TV talking and all." So I would say that right now, as I'm talking, the stigma, as it were, has already reached my family.
Interesting communication. The transportation of affected persons to the treatment centers has been described as one of the factors that are contributing to the stigmatization of persons who have been tested positive for COVID-19. When GBC got in touch with the Ghana Ambulance Service, the Senior Advanced Emergency Medical Technician, Mr. Yawose, said the ambulance service had revised its mode of operations. Let's listen to his response.
We have been talking about the mode of transportation of affected persons for some time. That if you are in a convoy with an ambulance, everybody in Ghana will know that you have COVID-19. We already have a problem with stigma. And once this is done, it already creates the attention you don't want. The last time we spoke to you, Mr. Osai, you told us that you were in conversations about rethinking that kind of Rambo style, as it were, mode of transporting affected persons. Has anything changed?
Let me just clarify this. You made mention that we carry people in a Rambo style. And I think that statement needs to be looked at. You know, in pandemic like this, we need to, as much as possible, to stop the spread of the disease. And each agency is responsible when it comes to the activities that you are supposed to play. And in a situation like this, you can obviously not leave National Ambulance Service out in terms of transporting of these cases. And let's not forget, before COVID-19 came, there are other people that have been moved to hospital every now and then who have other ailments. So now what we're doing is, we can't say we shouldn't move people in an ambulance. Let's not forget that we've segregated the ambulance we're using for the COVID cases. The other ambulances that carry other ordinary emergencies. So how would one be able to know that this ambulance is a COVID ambulance and the other is not a COVID ambulance? So our operational activity is being carried out every now and then. But it depends on the personnel on the ground. We have a dedicated team working on the ground in relation to this COVID cases. So, and they've been trained and they are professional about their work. Now, in terms of stigma, we realized that people were complaining when the ambulances get to their communities. Exactly. And for that matter, they prefer even meeting the ambulance halfway for them to be transported to the isolation centers. So, yeah, we want to also help in minimizing the stigma. So, we also agree with them, and we find an amicable solution in doing that.
Hopefully this will make a difference. Thank you again for being with us tonight. And again with me in the studio is Ibrahim Oponkwating, the Executive Director of the Crime Check Foundation and Prisons Ambassador. And later on we'll be joined by DSP Dr. Lawrence Achampong, the Medical Superintendent of the Nsawan Prisons. He'll be joining us via Zoom. So let's start like we always do with the COVID-19 figures globally and in Ghana. So as of 5 p.m. today, 4.7 million people have confirmed cases, 314,000 deaths, and 1.8 million people have recovered. And in Ghana, we have 5,735 confirmed cases, 29 deaths, and 1,754 recoveries. So, Mr. Nkrumah, how congested are the Ghana prisons?
Hugely congested. I'm sure your intro gave an account of how congested prisons are, hoping 52%. That is how serious it is, and it has come as a result of the architecture of the prisons itself. Most of the 44 prisons we have, most of them being relics of the British colonial administration, what I would say punitive structures. They weren't meant to rehabilitate human beings. But then these are structures that we are having, some of whom we are having as prisons. So when it happens that way, it creates room for massive congestion, and it results in a situation where the spread of communicable diseases cannot be discounted. It leads to situations where prisoners virtually have to squeeze and sleep. And I'm sure you may have seen some videos in the past, the way prisoners are arranged. And this puts a lot of stress on the prison facilities and infrastructure. And then when it happens like that, prisoners also have to queue at times, to visit the toilet, because the place is hugely congested. It has well created apprehension amongst prisoners when the bells ring for them to go and then sleep, because that is the most difficult, the most saddest part, because you're not going to sleep as you sleep in the comfort of your home. You are going to be, usually they have to be arranged. And so this goes to confirm how congested our prisons are. And then let's not also forget that out of the 44, successive governments have added just about 8 prisons, and most of them are settlement prisons meant for agriculture and so on and so forth. So there has not been, addition, proper addition, a mechanism to ensure that maybe every year the prison is built, every 2 years and so on and so forth. We don't have that. And this is creating, lots of problems for the prison administration, and then for wardens as well, because they have to, they are with the prisoners themselves. So the possibility of them also contracting communicable diseases cannot be discounted. And some prison officers have also contracted some communicable diseases in the past. So it is hugely congested.
Okay, so you talked about the fact that the conditions there date back to the British times. I know there was a project, IFIASE, that was developed to decongest the prisons and make that more humane. What happened to that project? Right,
it was a very good initiative, introduced to ensure that the prisons become purely correctional institutions. But for I don't know what really happened to that project, and so I don't want to talk a lot about that. And then the objective of the project was to tie in into the 10-year strategic development plan of the Ghana Prison Service, just as I said, to make the prisons purely correctional institutions, to ensure that the congestion is reduced, and so on and so forth. So I don't know, let me say perhaps it died a natural death. Just as I said, I don't know what may have led to the death. But one positive thing is that it created ambassadors. And I'm one of the products of Project IFIASE. And naturally, because I have a passion for the prisons, I have done a lot of work in that regard, doing a lot of advocacy on criminal justice reform, which is very, very important in this country. Also bringing to the doorsteps of Ghanaians the real prison picture in a bid to deter crime. Because, if you look at the crime rate in the country, you have a sense that most of the youth are not aware of the deplorable prison conditions where they would go eventually when they are apprehended, and so on and so forth. So we've been taking this advocacy to schools, churches, mosques. We have a program, Time with the Prisoner, to let Ghanaians know that these are what you go through when you eventually go to the prison. If you go around, if you go to Europe, if you go to the Americas, you know that their prisons are proper, they are reformation centers. You call them reformation centers, but we haven't got there yet. So we continue to do that advocacy, to draw public attention, to draw attention of government and other stakeholders in the criminal justice chain on the need to, reform the laws, obsolete laws handed down to us by the colonial master, as well as the need for government to also expand prison infrastructure, and also for Parliament to also amend obnoxious legislations that continue to push people into the prisons, leading to congestion.
You brought a video until something to show us?
Yeah, there is a video, and before the video goes on, the reason is that we are advocating for improved prison conditions and also a non-custodial sentencing law. We don't have a law on community service. The non-custodial sentencing bill has been in Parliament for so many years. This law, this bill, when passed into law, will lead to a situation whereby petty offenders, somebody goes and steals a fowl and then is given an outrageous sentence. We are not saying it's good to steal, but we believe that all these people should be given some work to do to serve as a deterrent to others. Our gutters are choked, our country stinks. So why do we have to put all these people behind bars for government to spend money on them? The person was asked to pay a fine of 200 Ghana cedis. He couldn't. He's been given a 2-3 year sentence, and government has to feed this person for 2 to 3 years. Do the arithmetic. Look at the amount of money government is going to spend on this person. So I'm sure you see in the video the need for the non-custodial sentencing bill to be passed into law. Pregnant women being sent into prison. A flagrant violation of the law that says that they should be given sentences in absentia and so on, and so suspended sentences. So these are some of the things that we are advocating for.
Okay, let's have a look at the video.
Then I do baha.
I told him to far Puma.
Oko fa Puma. Puma se sensa.
For Puma.
By the do say na mutu ye. 8. Baku 8. Hwemenim na kan okra kire me. 1 2 adaka. Baku 8. Ena ye den. Utu ye na ye den.
Na edikotoma ye sister.
Okotoma mu sister. Moton ne sen. 8 cedis. Na ne ma wo sen. 6 months. Case be na unya.
Minya aponchi case bi na me ba.
Unya aponchi case. Na den akoye do ba.
Kube na mko fine na mde mba.
Who ye den wo fi ha?
Mba cho we case na de mba.
Akusia na edin na do be wi fi ase.
Be ma me ne nete. Na okofo obi aka me ho. Na me ni obi na konye. Na mi plan. Na obi no koye report ma police for be che me na judge jail me 2 years.
Cho me ni me ma me nua ba ne konye. E de ma be pia. The head no free asemu. Okay ka ne burofo bi wo ho. On what dey pen. Sister so the metia na say him 5 years.
The man doing the woman. Yes, I had dinner, mamma.
Ama, aha, ena yedo uba.
Nyani mio. Na say Diana meswa obi nyani mio. Na say Diana obi nyani mio. I am say that yes.
Menemo kasa wie pe mu nyina mu kofi. Now, to paraphrase Professor Michael Craig, the law must be applied with common sense in certain contexts.
So that's great. But I do, just to add to your point, 4 UN agencies, including WHO, issued a joint statement not too long ago on COVID-19 in prisons and other closed settings. And they urge political leaders not only to enhance the efforts for the non-custodial measures you were talking about, but they also want a consideration for limiting the deprivation of liberty to include pretrial detention to a measure of last resort, particularly in the case of overcrowding, like you said we have here. So what are your thoughts on that, the pretrial detention?
Absolutely.
Also?
I think it fits into, the advocacy that we continue to do, that as a country, we should not be pushing people into prison needlessly, and that petty offenders should at least be given community service. The law, as I said, has been in Parliament for so many years. Nothing has been done. There appears to be no urgency. So why wouldn't our prisons be congested? Somebody steals a fowl. You saw some of these petty thieves in the video. 2 bags of yam, he goes to prison. What is the benefit when these people should be working? Recently, I think about a month or 2 ago, the president granted amnesty to 808 prisoners. And the positive thing about it is that most of them included petty offenders. It's time we need to holistically look at the laws of this country, especially obsolete laws that were handed to us by the British colonial administration. If we don't do that, then our prisons will continue to be congested. Because crime is cyclical. People are being pushed in and day out. The prison service is going through lots of challenges. And then when that happens, when they are confronted with such hydra-headed problems, it defeats the purpose of reformation and rehabilitation of prisoners, which is a core mandate of the Ghana Prison Service. So it is important that as a nation, we see the passage of the non-custodial bill into law as crucial in decongesting our prisons. So what we have done the past 3 years as an organization is that we have released 472 petty offenders. We pay their fines, and we are still doing that. We work in close collaboration with the Ghana Prison Service.
So talking about working with the Ghana Prison, close collaboration. So last week, the Greater Accra Regional Police Command mentioned that the coronavirus was now in the prisons. Have you been in contact with them? Do you know how many cases we are talking about and how that's being managed?
I don't have the numbers, and I'm sure Doc will be joining us to give the details. But I think it's important. That is the reason why we should be all alarmed. Because just look at the prison architecture. If there is infection, then we are all at risk. We are all at risk. Don't also forget that the prison officer is the point of contact. He has a family. If the prison officer also has to take trotro home, the possibility of infection cannot be discounted. He comes in, he has that close contact with the prisoner. So if you are not careful, there is going to be a messy situation. That is why we have to immediately put structures in place. How many isolation centers do we have in the prisons? Government should be forthcoming. This is the time government should support the Ghana Prison Service. Because we know the challenges, the feeding fee. This is the time, you know the COVID problem. There's the need to boost our immune system. And you know the prison food, 1 cedi 80 pesos, which means that a prisoner feeds on 60 pesos in the morning, 60 pesos in the afternoon, and 60 pesos in the evening. The contractor who is even cooking the food is also taxed. So in effect, it is not 1 cedi 80 pesos. How do we expect the immune systems of prisoners to be boosted? The prison service is not a magician institution. That is why stakeholders in the criminal justice chain should at least support the Ghana Prison Service. They are a recipient institution. So once you have a valid warrant and you bring someone, they are bound by law to accept the inmate. Now, when the police brings in convicts, they're supposed to take them in. But don't forget that when they come in, they ought to be quarantined. And then many inmates continue to come in, many convicts continue to come in. So and then we have 7 isolation centers in the prison. So we have a very serious situation on hand. So I'll use this opportunity to appeal to government and other stakeholders in the criminal justice chain to see this development as an urgent one, or else we are all in trouble.
So we have DSP Dr. Lawrence Achampong on the phone. Good evening. I wanted to start by asking you about the situation in the prisons. Could you tell us what is being done in terms of protocols when it comes to COVID-19 and prevention for the prisoners?
Hello?
Hello, good evening.
Good evening. Can you hear me?
Yes, I can. I can hear you quite well.
Good. I would like to say good evening to your cherished listeners and to my brother Ibrahim Kwatin in the studio as well. Thank you for the opportunity again. I would like to start by enumerating some of the things that have been put in place when the Ghana Prison Service started preparation towards this COVID-19. First of all, before even the disease came to Ghana, there was a health alert to all our prisons to alert them of the emergence of this global situation. By that time, it was in China. Subsequently, there was guidelines to all prisons because we cannot continue to practice the same way we used to. There has to be some changes in the dynamism of the prison setup. That was communicated to us by our Director General through the Health Directorate of the Prison Service. Aside that, all OICs and all stations in terms of all prisons were made aware to provide the basic hand hygiene apparatus, especially Veronica buckets, sanitizers, to try to help with the inmates and the officers who get in and out of the prisons. Due to the changing times, we cannot continue to still be having these isolation and observations in all our major prisons. So that is why we have earmarked some selected prisons, about 7 of them, to receive all new admissions. They are not isolation centers. They are places where we will receive new admissions. If you look at a place like in Sanwom, a place like Koforidua, Kumasi Central Prison, the number of inmates there are so many, and we can never handle an outbreak of COVID-19 in those prisons. So we have earmarked and selected prisons where we can serve any convict or any prisoner that is sent to any of the prisons. So it's kind of a diversion from most of our densely populated prisons to a less densely populated prison, so as to be able to handle any outbreak. That is the other intervention. There are also interventions to also, in fact, we have also earmarked something we call a prison quarantine center, where we are planning that it might get to a point where we might have a lot of prisoners having the COVID-19. Where should we keep them? We have to have a place that we call prison quarantine center, where we will keep prisoners and we will liaise with the Ghana Health Service and the Ministry of Health to make sure that we provide care for these prisoners as well. We have another prison in Sanwom that is specially a remand prison, and even the Pentecost Church is also building another camp prison also in Sanwom. So if all these structures are completed, there will be some ease in the system for this congestion to come down. But notwithstanding, we cannot overlook the fact that amnesty and pardon is also another form of trying to decongest the prison. If we are to segregate that, this is a health professional inside. The person entering the prison gate might have spread the disease to the officer at the gate. Into the reception area will spread it. So every officer must be must be known and must be appreciated as a frontline worker. And all intent must actually also be accorded these officers as well. And with respect to training, we would like to also seek attention of the national COVID-19 team and the task force that they should involve the prison officers and the prison in all aspects of training. some of us were trained training platform for prison officers, because even the contact tracing alone in prison is different from the contact tracing in the general society. And we must make sure that some of these things are looked at before we experience any exponential outbreak. Thank you very much.
Thank you so much, DSP Dr. Lawrence Achampong, Medical Superintendent of the Nsawam Prisons. Thank you for joining us. So, Mr. Kwarteng, we talked a lot about the decongestion. So, in early March, or late March, sorry, the President
granted amnesty.
Yeah, to 808 inmates. Of course, according to the prison service, it was not related to decongestion. But do you think this is also a time for government to take a look at how decongestion can be reduced through something like that? Maybe
absolutely.
Non-violent offenders and
absolutely. And then I think it's also important that government also takes another look at the aged in our prisons. And Doc admitted that there's huge aging population in our prisons. Of course, some of them may not qualify by amnesty by the nature of their crimes, especially if the person have committed murder or has a high-profile case that brought them to prison. But then if you look at some of the ages, you may have seen the video, a man who is almost 100 years. What kind of threat do such people constitute to society? So it's important that though we have the rules for granting amnesty, the president, because he has the prerogative of mercy, you cannot drag the president to court for not granting amnesty and so on and so forth. But this is the time, we are in unusual times, that we expand our scope and then add people who may not necessarily qualify for amnesty, but by dint of their peculiar situation, they should be granted amnesty to decongest the prison. And I want to make a quick point. Infractions of the law, because we are looking at ways that would reduce congestion in our prisons. We would also want to appeal to our judges. Some of the sentences are a bit outrageous. Someone goes to, commits a petty offense, the person is given 5, 8 years, which means that the person has to spend so many years in the prison, adding to the congestion. And then infractions of the law by criminal justice agents. The way some police officers, some prosecutors allegedly mislead accused persons is worrying. And this is also leading to congestion in our prisons. Most of these accused persons are illiterates who cannot even distinguish between what is meant by innocence and what is meant by guilty. And some of these unscrupulous officers, what they do is that they ask the accused person to plead guilty. And at times the judge will ask them, are you sure you are guilty? Because they don't know. Because the officer wants to prevent the situation whereby when the case is adjourned, he has to be moving the accused person up and down. And so these are some of the things that also leads to the congestion. So we want to appeal to the police administration to also take a look at the activities of miscreants within the service, whose activities have also contributed to congestion in our prisons.
Okay, so let's take some of your comments. Prisons for the time past have been very congested, and we'll be grateful to our current prison administrators for good work done. We must begin to look at the reformative intent of the prison as well as the rehabilitation of offenders as stressed. The two should be our main focus so far as prison ministry is concerned. These will help in the decongestion of our prisons. We also use the opportunity to appreciate Reverend Steve Bingham and all others who have contributed immensely to Ghana prison reforms in our countries. Kudos to you and your panel. This is from Professor William Kudoyo of the University of Ghana. Okay, so you look at we always look at COVID-19 as something negative. I always try and say that there's got to be something else that we can look at it up for. So COVID-19 is coming up as a disruptor in how we are improving our lives, because everybody is doing things differently, better, healthier. So I'm trying to figure out, it may be tough for us to see any benefits to the prison service, but maybe there are some protocols that are being adopted now that would be helpful in the long-term management of the prisons, like the non-custodial services, for example, if we're able to push that through right now. So what other things can you think about that maybe through this pandemic we'll be able to ameliorate the prison service?
Absolutely. I would also want to appeal to government to also look at our legal aid scheme. you don't have a properly functioning legal aid scheme, how many accused persons have access to lawyers? It is a worrying situation. When we have high-profile cases, political cases, they can drag on for 2 to 3 years at the courts, delaying situations where people have to go to prison. Someone goes to steal a file and it is quickly, the person is quickly dispatched to the prison, further adding onto the congestion. So I want to appeal to government to resource the legal aid scheme.
Okay. Just a few more comments. It's very sad to hear Dr. Lawrence Achampong's account of the current situation regarding health structures and measures of personnel. 2 doctors to 15,000 prisoners. The prison populations have an overrepresentation of people with substance use disorders, HIV, tuberculosis, hepatitis. So the rate of infection of diseases in such a confined population is also higher than among the general population. We need serious reforms in our criminal justice system. COVID-19 is an eye-opener to all governments to do something about their criminal justice systems and serious reforms with our prison. Finally, in order to decongest our prisons, it's important that we review our criminal justice system and our sentencing regimes. We in Penal Reform Ghana fully support calls for the passage of the non-custodial sentencing bill. This is because when the bill becomes law, it will help in effectively addressing overcrowding or congestion in our prisons. And this is from Evans Oheniba Mensah, the Executive Director of Penal Reform Ghana.
Right. I also wanted to make a point, because I understand there are some doctors who are serving sentences in our prisons. So can the prison service also make use of such doctors? Because we know, inmates who are teachers, who are contributing to the reformation and rehabilitation of inmates. So if we have a doctor, because Dr. Achampong, his claim is worrying, 2 doctors, and especially during this COVID time. So if you can make use of prisoners who are doctors, and I know at least there are some 1 or 2, inmates I know are doctors, why not? I think it will be important that we tap their expertise to help at this crucial time, instead of just 2 doctors. The Ministry of Health is not seconding doctors, so this is a serious situation. So I'd also want to appeal to the prison service. So if possible, if they can make use of these doctors, I think it will go a long way to help address some of the teething challenges that they are having currently.
So we've talked a lot about the prisoners, but I'm wondering how they feel. Have you been able to talk to any of them during this outbreak to figure out how they are feeling in the prisons? How worried are they?
I haven't spoken to them as yet, but
okay.
Based on the work that I've done in the prison, definitely there will be general apprehension. There will be that fear. Because just imagine when they are going to sleep, how they are arranged, assuming 1 inmate has this disease. So I just can't bring myself to, I just want to fathom how the situation is like, especially the discussions that they have every now and then. That is why it is important for civil society, for philanthropists, for government to see this as a national emergency. In other countries, prisoners are being freed because of the COVID situation. I'd also want to use this opportunity to appeal to the President. 808, well done, but not enough. This is the time that many people who have committed minor offenders, more should be considered. And also I made a point that the aged they may not qualify for amnesty, we know. But because of the unusual times that we have, and because of the fact that they do not constitute any threat to society, this is the time for us to have a rethink, and then possibly let these people go home, join their families, instead of having underlying conditions in the prison, a situation that could facilitate their death should they contract COVID-19.
So your final thoughts, but before then, if you could just tell us what can be done to move the non-custodial sentencing bill.
Absolutely, we have to.
Ghana Prison Service, a few others are really behind
I know
this.
a lot of work has been done, but it's been too slow. I have an opportunity about 2 years ago to go to Parliament, the Speaker's office, and then I raised the issue, and then he said Parliament was working hard to pass the non-custodial sentencing bill into law. If Professor Michael Kwe is listening, I'd want to remind him of the promise he made. Looking at the COVID situation, this is the time we should have had such a law. I'd also want to appeal to the lawmakers to see the passage of the non-custodial sentencing bill as a priority, something that affects all of us. When someone is seen working broad daylight in the gutter, it's a disincentive to other people who want to commit crime. Just imagine, someone who has made it in life, deserting the gutters in broad daylight. These are things we want to see. China is exporting prisoners. They are making lots of money from that. But we have decided to warehouse our prisoners and then feed them with the taxpayers' money. It doesn't make sense. So we have to have a look holistically and then see the passage of this bill as a necessity.
Thank you so much. Thank you for joining us on tonight's show. A special thank you to our panelists, Ibrahim Oponko-Ating, Executive Director, Crime Check Foundation, and an ambassador for the Ghana Prison Service. And of course, via Zoom, we had DSP Dr. Lawrence Achampong, the Medical Superintendent of the Nsawam prisons. And to you, our viewers, as always, good night, good luck, and please stay and be safe. Good night.